Have you ever wondered why opening your mouth, chewing, talking, or swallowing can become difficult after head and neck cancer treatment? The answer often starts with understanding the anatomy of your jaw. I'm Lauren Meffin, speech-language pathologist, certified lymphedema therapist, and Trismus intervention specialist. Today, I'm going to walk you through the anatomy of your jaw and explain what matters, why it matters for your recovery. Let's start with the basics. Your jaw is much more than a bone that holds your teeth. Your jaw is a complex system made up of bones, muscles, joints, nerves, and connective tissues that all work together every time you speak, yawn, laugh, or swallow. The lower jaw, called the mandible, is the only movable bone in your face. This is the bone that opens and closes your mouth and allows you to chew food. The upper jaw, called the maxilla, is fixed to your skull, and it serves as the foundation for your upper teeth and portions of your nose and eye sockets. Together, these structures create the framework of your mouth. Now let's talk about the muscles. Many people are surprised to learn that several powerful muscles control jaw movement. The masseter muscle is one of the strongest muscles in the body relative to its size. Its primary job is to close your mouth and generate the force needed for chewing. The temporalis muscle sits along the side of your head and assists with closing and positioning the jaw. Deeper inside are the pterygoid muscles. These help open your mouth, move your jaw forward, and create side-to-side motions necessary for grinding food. Following surgery, radiation, or cancer treatment, these muscles can become painful, weak, tight, or fibrotic. When this happens, opening the mouth may become difficult. This condition is known as trismus. Trismus is generally defined as a mouth opening less than 35 millimeters and can significantly impact eating, speaking, oral hygiene, dental care, and quality of life. Now let's discuss one of the most important structures in the jaw, the temporomandibular joint, often called the TMJ. People think of the jaw as a simple hinge. It's actually much more sophisticated. The TMJ functions as both a hinge and a sliding joint. When you first begin opening your mouth, the joint rotates, and as you continue opening wider, the jawbone glides forward to create greater movement. Now, between the jawbone and the skull sits a specialized cushioning disc, and that helps to absorb forces and allows a smooth motion. With the surrounding muscles, when they become restricted, this normal pattern can become disrupted. Now let's talk about the nerves. The primary nerve supplying the jaw is called the mandibular branch of the trigeminal nerve. This nerve provides sensation to the lower jaw, teeth, tongue, lips, chin, and portions of the mouth. It controls many of the muscles involved in chewing, and changes involving these nerves may contribute to pain, altered sensation, or difficulty moving the jaw after treatment. Finally, let's discuss the purpose of the jaw. Its primary job is to support the teeth, allow us to chew efficiently. Every bite you take depends on a highly coordinated system involving the jaw joint, the muscles, the tongue, the teeth, and the nervous system. When one part of that system becomes impaired, the entire process can be affected. This is why early intervention for trismus is so important. The earlier we identify changes in jaw mobility, the greater the opportunity we have to preserve the function and maintain quality of life. Understanding the anatomy of your jaw helps you to understand why stretching, exercises, manual therapy, and ongoing monitoring may be recommended as part of your recovery plan. If you'd like to learn more and download this handout that accompanies this video, I'm going to encourage you to download our HNC Lymph SLP app in the link below. This app will provide resources for swallowing, oral exercises, tongue training, and additional educations, videos, and handouts, as well as tools to better help you understand your recovery journey. I'm Lauren Meffin, and I continue to look forward to seeing you in our next video and in our community.